Hellfire. Trump just made ultimate threat to Republican senators. They are terrified. President Donald Trump unleashed all hell at a special lunch for Republican senators today. Those poor saps had no clue what they were in for. The setup for the lunch was suspicious enough. Trump himself had carefully chosen the seats, choosing to put the biggest pro-Obamacare Senator Dean Heller of Nevada right next to him. Then he dropped this massive bombshell. He demanded they all cancel any Senate recess until health care is solved. Wow.
Prognosis with a problem. I'd like the federal government to focus on the Middle East, to focus on North Korea, to focus on things where we have very big problems. The states can do a better job than the federal government when it comes to health care. And that's what we're letting you do. And we're committing $45 billion to help combat the opioid epidemic, and some states in particular like that. So my message today is really simple. We have to stay here, we shouldn't leave town, and we should hammer this out and get it done. And not just a repeal. Hey, it was sort of early on, along with a few of the other folks at the table. The repeal was fine. I was fine. But we ought to get more than I think the people of this country need more than a repeal. They need a repeal and a replace. And we were very, very close. And then little things happened. But now we're very close again. We have to get it there. Now, with John Cornyn the other night, we had a couple of things that we put down on paper. I'm just going to read them really fast, but these are some of the things that are done, because the Democrats are always selling their plan, but they don't do that anymore. They don't talk about Obamacare anymore because they can't, because it's failed. They know it. So they're selling their plan, and we never sell our plan. If we're weak on anything, it's on letting people know how good it was. So we wrote down these few things. Repeals the individual mandate. How big is that? Where people are paying not to have insurance. Nobody ever talks about that. Repeals job-killing employer mandate. How big is that? Will substantially lower premiums. And remember this, cross-country lines, cross-state lines, where you have where it's almost impossible for insurance companies to compete in different states. We can't because of, unfortunately, the 60 votes. Put that here, but it's going to come very soon. We're putting it in a popular bill, and that will come. And that will come, and your premiums will be down 60 and 70%. People don't know that. Nobody hears it. Nobody talks about it. But your premiums are we're going to have the cross-state lines knocked out, and you'll have insurance companies bidding. You'll have forms of insurance that you don't even know about right now, because that's the way it works. There's going to be tremendous competition. So your premiums will be substantially lower. Repeals burdensome taxes, big. Will restore choices. The bill also provides for expanded coverage options, the options. So you're going to have a tremendously expanded coverage and options. Will stabilize insurance markets. The markets right now, by the way, are gone. They're a mess. And depending on what happens here, depending on what happens over the next couple of weeks, the insurance companies are all fleeing. Will protect pre-existing condition coverage. You listen to the Democrats, they say, oh, they're giving up. You're going to have better pre-existing than they had in their plan. And you're going to be protected. Will allow the use of pre-tax dollars to pay premiums. Will expand the HSAs. Will devote substantial resources to fight opioid and other substance abuse. Will provide better coverage for low-income Americans. By the way, low-income Americans under our plan, and we're doing things at this meeting which I think you'll be very happy about, because we're going to spend some more money to make sure everybody is protected. We'll provide better coverage for low-income Americans. We'll improve medical outcomes for low-income Americans. puts Medicaid on a sustainable path, which it's not on right now, levels the playing field for states when it comes to federal dollars, reforms major entitlements, now a principal driver of the $20 trillion debt that we have, and will redirect authority from Washington, D.C. to the states, which I've already said, where they can innovate and develop the best practices, and on a smaller basis, they'll be able to take care of people better. So we can repeal, but we should repeal and replace, and we shouldn't leave town until this is complete, until this bill is on my desk, and until we all go over to the Oval Office. I'll sign it and we can celebrate for the American people. Thank you very much. Thank you.
He's a businessman. Did the president stop there? Heck no. He doubled down and sent shockwaves throughout the senators by what he said next. President Trump was not joking around one bit. He also told Heller to his face that he and the party will not support any Republican who continues to put off health care. I mean, I'm not really thrilled with the health care bill, because none of these people take this health care that they're trying to pass off on the people. I think they're just trying to boost the economy somehow. I mean, I don't know really what's going on, but you know, I've listened to the guy at X22 Report, and he's got a very, you know, he's more into all of this, and he explains things very well. You should take a listen to X22 Report. He's amazing. Let's just take a listen now to what senators who oppose the health bill may not be friends.
Lie. It was a lie directly from the president. You can keep your doctor. You can keep your plan. 28 times he said it. 28 times. And it was a lie, and he knew it was. And now it's hurting this country irreparably. Premiums are so high that 6.5 million Americans chose to pay a fine to the IRS instead of buying insurance, the famous mandate. We will pay not to take the insurance. People don't understand that. They don't even understand what it is or what it represents. If Obamacare is not repealed in 2018, over 1,300 counties in the United States will have only one insurer. 40 counties will have absolutely no coverage in the exchange. And that number will grow rapidly. And I think those numbers are extremely conservative. I think they're very low. I've been here just 6 months. I'm ready to act. I have pen in hand, believe me. I'm sitting in that office. I have pen in hand. You never had that before. You know, for 7 years you had an easy route. We'll repeal, we'll replace, and he's never going to sign it. But I'm signing it. So it's a little bit different. But I'm ready to act. For 7 years you promised the American people that you would repeal Obamacare. People are hurting. Inaction is not an option. And frankly, I don't think we should leave town unless we have a health insurance plan, unless we can give our people great health care. Because we're close. We're very close. The other night I was very surprised when I heard a couple of my friends, they really were and are. They might not be very much longer, but that's okay. I think I have to get them back. That's right. Well, no, you didn't go out there. This was the one we were worried about. You weren't there, but you're going to be. You're going to be. Look, he wants to remain a senator, doesn't he? Okay. And I think the people of your state, which I know very well, I think they're going to appreciate what you hopefully will do. Any senator who votes against starting debate is really telling America that you're fine with Obamacare. But being fine with Obamacare isn't an option for another reason, because it's gone. It's failed. Not going to be around. We pay hundreds of millions of dollars a month in subsidy that the courts don't even want us to pay. And when those payments stop, it stops immediately. It doesn't take 2 years, 3 years, 1 year. It stops immediately. On the other hand, and I have to say this, a yes vote will let senators debate the future of health care and suggest different ways to improve the bill. And we're going to do that today. That's what we're going to do at lunch. We are so close. The way I looked at it, you know, we have no Democrat help. They're obstructionists. That's all they're good at, is obstruction. They have no ideas. They've gone so far left. They're looking for single payer. That's what they want. But single payer will bankrupt our country because it's more than we do for just health care. So single payer is never going to work, but that's what they'd like to do. They have no idea what the consequence will be, and it will be horrible, horrible health care where you wait online for weeks to even see a doctor. But we're going to expand tax-free health savings account, the HSAs, to increase health care coverage, getting Washington out of the way and giving more control and funding back to the states, stabilizing exchange.
Well, I don't know. I don't know, folks. If you can tell me, you have a better idea. I don't know. But the only thing that I have to say is, will these politicians take the same health care that they're trying to push on the people? That's basically the bottom line. And unless they take the same health care, why are they trying to push this on the people when they're not taking the same health care? If the health care program was good, they would take it themselves, and yet they're not taking it themselves, and they're putting everybody else on this plan. So to me, it doesn't make sense, because somebody that's paying, let's say for a family of 4, they're paying in the range of $2,000 a month. Okay, he says 60 to 70% reduction. You're talking at least, I'll go with 70% on the $2,000. It's $600 a month. A lot of people don't have $600 a month to pay for health care. They're trying to make ends meet just as it is. And a lot of people are unemployed. So I don't understand. This is all falling apart on everybody. That's my take on it. I'm not really that, you know, intellectually there. I can't make decisions for the people, but it's still a lot of money every month. To me, it seems like a lot of money. Let us know what you think in the comments below, and thank you so much for watching.